Hello, and welcome to part 2 of Diversity in Sports Medicine. So, as we left off from the previous presentation, what we want to do here is understand one of the most important parts of becoming culturally competent, and that is understanding yourself. Before one can understand others, you must understand yourself. And so one of the first things that we want you to do is to try to identify what your own personal culture is. Many of you may be sitting there thinking, well, I don't have a culture, I don't come from a specific culture. Your culture may be anything from identifying as American, as Christian, as Black, as middle class, Jewish, Irish, etc. So everyone does have culture. It's just a matter of figuring out what your culture is. Culture can be defined as the sum total of socially inherited characteristics of a human group that comprises everything which one generation can tell, convey, or hand down to the next. So this might be anything from traditions that you have in your family for holidays, or traditions that you have as far as what you do for fun with your family or in your neighborhood where you grew up, what type of culture you grew up in. That may be religious beliefs, or it could be something that was applied based on the class that you grew up in. So your culture is actually developed from many different factors. So again, in order to become culturally competent, we need to understand ourselves. And so the first step in becoming culturally competent is having all of us become culturally aware of our own values, biases, and assumptions about human behavior. So we ask the question, what stereotypes, perceptions, and beliefs do we hold about culturally diverse groups that may hinder our ability to form a helpful and effective relationship as athletic trainers? So go ahead and pause the video here and try to think about, in your own personal life and worldview, what stereotypes, perceptions, and beliefs you might have that possibly might hinder your ability to have an effective relationship with a patient based on what you believe or what your perceptions may be. And this sometimes is difficult for many individuals to do because it involves questioning yourself and maybe even your moral beliefs. However, without such an awareness and understanding, we may inadvertently assume that everyone shares our own worldview. When this happens, we may actually become guilty of cultural oppression, imposing values on our own culturally diverse clients. Meaning, if we take the viewpoint that our own worldview or what we believe is really how everybody should believe, or how we see things is how everybody should see things, then we'll end up oppressing other groups because we're not taking into consideration what they believe. So one factor that it is important to understand is something known as privilege. And privilege can be defined as a right or immunity granted as an advantage or favor, especially to some and not to others. So often these are quote-unquote benefits that one may or may not be aware of that he or she has based on race, sex, religion, and etc. And one way of thinking about privilege is that if you don't have to think about it, it's a privilege. If you don't have to think about your sex or your race or your religion when you're going throughout your daily life, then that is a privilege. And often privilege, especially when we are unaware or unconscious of our privilege, will actually perpetuate prejudice, which then perpetuates oppression and marginalization, and so not allowing certain groups to succeed, essentially, in society based on our own. So again, here's a few great examples of privilege. And like I said, if you don't have to think about it, then it's considered a privilege. So if you can use public bathrooms without stares, fears, or anxiety, you have cisgender privilege. And on the bottom there, you can see that cisgender is a description for a person whose gender identity, gender expression, and biological sex all align, which is what we talked about earlier, the difference between gender and sex. So again, if you if your sex is female and you identify your gender as female and you can enter a female restroom at a public rest stop, you probably don't think about being nervous or anxious or having to worry about what others are going to think about you when you enter that bathroom. Yet if you are transgender or cisgender, then there's a chance that you might have those fears. Another example, if while growing up, college was an expectation of you, not a lofty dream, you likely have class privilege. If this was something that was never a second thought, your parents or whomever helped support you when you were being raised always expected and you knew that you were going to go to college, this is actually a privilege. This is class privilege. If you can expect time off from work to celebrate your religious holidays, likely you have Christian privilege, and that is especially true in the United States here. Most other religions, certainly Jewish holidays, those holidays are not expected time off in many workplaces and in the public school system. Becoming aware of privilege should not be viewed as a burden or source of guilt. So many of you may have read those specific examples of privilege and thought, well, that makes me feel bad about myself, that I have these privileges. But rather, it should be seen as an opportunity to learn and be responsible so that we may work towards a more just and inclusive world. So the more aware we are of our privileges, whatever those privileges may be, whether they're able-bodied privileges, heterosexual privileges, white or male or class or Christian privileges, if we're more aware of those privileges, we're going to have the opportunity to be more responsible and culturally sensitive based on understanding our own privileges. So here's a few questions that will hopefully help you explore yourself and your own privilege. So when you wake up in the morning and throughout your day, how often do you think about the color of your skin? And go ahead and pause the video as you need to answer these questions on your worksheet. If the answer is never or hardly ever, do you think that's the same for people of color or minority races? Do you think that they often think more about the color of their skin throughout their day? Males, throughout your day, how often do you think about being a male? And females, how often does it cross your mind that you are a female or that you're not a male? And think about vice versa. Males, do you think that females are more aware or have to think more about, yep, I'm a woman? Or females, do you think it's the same for males? Okay, the next step in becoming culturally competent is having all of us acquire knowledge and understanding of the worldview of other culturally diverse groups and individuals. And so, first we must become very aware of ourselves, like we said in step 1, becoming culturally competent. Becoming self-aware of our own biases or privileges. The second step is actually understanding other diverse groups different from ourselves and their worldviews and their experiences. So again, a few other questions here. Do you think the worldviews of other racial groups such as African American, Asian American, Latino or Latina, and Hispanic American or American Indian, and maybe you fit into some of these racial groups as well, do you think that those worldviews differ from yours? Do other culturally different groups, so women, the physically challenged, gays, or lesbians, do you think that they have other different worldviews as well? And to understand this better, a worldview is a conception or a philosophy of the world or life, how they perceive their experiences in life. And step 3 for becoming culturally competent is understanding how organizational and institutional forces may either enhance or negate the development of our cultural competence. So, for example, it does little good for any of us to be culturally competent when the very organization that employs us, or maybe school that we're learning from, are filled with monocultural policies, so meaning one culture. So, for example, hiring men over women in the NFL, in sports culture, that is happening right now in our society. Hiring white men over black men, which in the United States is still happening. Developing new rules, regulations, policies, practices, and structures, therefore, within organizations will enhance multiculturalism. And this is very important for that to occur. If we work for an organization or we learn from a school that adopts, like we said, a monocultural policy or perception in which one culture is right, then we're not going to be able to provide culturally competent care. So pause the video again and answer the question, can you name a practice that a sport or sports medicine organization has implemented to enhance multiculturalism? And it may be hiring practices, it may be policies within the organization that may enhance diversity or multiculturalism. So getting back to how this is important for our clinical practice. So we must be aware that persons of color, gays or lesbians, women, and other groups may perceive illness or health and the healing process differently than you do. So it's, as we mentioned in the previous video, we need to be aware that Euro-American healing standards originate from a cultural context. So this means that what we know as far as Western medicine was developed in Western culture, and it represents only one form of helping or healing. So what we do in Western medicine and clinical practice in Western medicine does not mean necessarily that it is the right or best way. It may be only, quote unquote, the best way for the culture whom developed it, so the culture in Western medicine. So here we're going to actually have 3 different clinical applications in which you're going to read a scenario and answer some questions related to that scenario. Feel free to pause the video as needed. So in clinical application 1, a patient reports to the athletic training facility after claiming to be in serious pain the week before and now seems to be miraculously healed. The athletic trainers wonder if the patient was even really injured in the first place. When asked what she did to heal it, the patient claimed she stretched, got a massage, and prayed a lot. One of the athletic trainers giggled and claimed, "Yeah, that's definitely what healed you." So go ahead and answer the questions here. Why was this scenario culturally insensitive? What consequences could this type of reaction by the athletic trainer have on the patient? And what type of consequences could it have on the patient's care? And lastly, what should the athletic trainer have done differently, even if she or he does not agree with the patient's religious views? On to clinical application number 2. A collegiate field hockey player reports to the athletic training facility and meets her athletic trainer, Brandon. While completing her rehab, Brandon is having a conversation with a football player about the game the day before. During the conversation, the athlete curses, and Brandon tells the football player to watch his mouth because there's ladies in the room. Again, why was this scenario culturally insensitive? What consequences could this type of reaction by the athletic trainer have on the patient, as well as the patient's care? And lastly, what should the athletic trainer have done differently? And clinical application number 3. A basketball athlete reports to the athletic training facility for preseason physicals. After completing his baseline concussion test, assessing his verbal memory, visual memory, and concentration, the athletic trainer evaluates his scores. The conversation followed. Athletic trainer: "Your test is all completed. Great job, buddy." Athlete: "Thanks. That was actually really hard." Athletic trainer, jokingly: "You did great on both memory and concentration. I'm assuming you do pretty well on exams, huh? You're lucky you got both the athletic and Asian genes." Why was this scenario culturally insensitive? And secondly, what consequences could this type of reaction by the athletic trainer have on the patient, as well as on the patient's care? And lastly, what should the athletic trainer have done differently? Again, pause the video as needed to answer these questions. Here are some references for you to refer back to from this presentation, if needed. I also added in this slide so you can have one specific reference regarding cultural competence in sports medicine. This is an actual textbook written by Cartwright and Shingles that is specific to sports medicine and actually outlines hundreds of different types of cultures and scenarios that one may come across in sports medicine and treating patients. It is a great reference guide. So now, after completing these videos, open up the link to the journal article by Mara, Kovasin, Shingles, Canati, and Makawak to answer the last question on your ticket in regarding this journal article. See you in class.